One of the common questions which I get is, when do we need to do surgery for umbilical hernia? Is it urgent? Should I do it today, tomorrow, or do I have time? Is there any fixed period of time I can wait and then plan for the surgery? Now, all these depends on the symptoms you are having. Let us say there is a small hernia defect that you have noticed while you do your general body checkup, annual health checkup, a small defect 0.5 centimeters, or rather 5 mm to 10 mm. We generally wait. It's not an emergency that you need to undergo some surgery, but we can wait. You can choose your time, you can plan your surgery. Let's say you have some social commitments, all those things. You can wait and then plan accordingly. Now, if you are having symptoms, what are the symptoms of problems with an umbilical hernia? If you're having recurrent pain in the belly button area, you get a lump that is staying for a couple of hours, it is not reducing, you're having pain, maybe eventually after a couple of hours of resting or something, it's falling down. These are definitely warning signs and impending signs of some complication that is about to happen. So that time, please visit the surgeon, and if he tells you please get operated early, please do so. Earlier the better. Now, let us say you have a hernia that's approximately 1.5 centimeters, but if you are into weightlifting or heavy object lifting, definitely an indication earlier the surgery better, because every time you lift weight, every time you increase your abdominal pressure, the hernia increases, chances of intestine getting blocked in the hernia hole is higher. Now, many females come with hernias after their pregnancy, immediately after their pregnancy. Example, let us say they had their delivery, 1 or 2 months later, they have noticed a bulge in the belly button area. This is quite common in females. Normally, we don't advise immediate surgery. Good amount of exercise, muscle toning, generally the defects are able to reduce. But in case after 6 months also the defects are not getting closed, it will be wise to plan or correct the hernia defect. How to correct, we will discuss in another video regarding exclusively post-pregnancy hernias. Now, let us say some person has a chronic cough. Maybe he might have bronchitis because of smoking previously, or let's say asthma problem has been there. He has a recurrent cough and he has a hernia. See, this sort of scenario, it is better do some aggressive treatment to control the cough and do the hernia surgery as early as possible, because the later we do it, chances of more intestines coming and getting sucked into that hernia hole and getting blocked. So ideally, earlier the hernia surgery, the better in such cases. So just to brief it all, if in case you have a small hernia that is not symptomatic, you have time, you can wait, you can decide, you can take your convenience, plan the surgery accordingly with your surgeon. But let us say you have a larger defect, 1.5 centimeter defect, and if you have chronic cough, constipation issues, urinary issues, something that leads to increase in intra-abdominal pressure, that is the pressure in your tummy, and this leads to increase in hernia or chances of complication. Such people you have to plan early. But in case you come to the hospital or you visit a surgeon with pain and there's a bulge, there's no waiting, you have to undergo an emergency surgery. So don't wait till the time complications occur. It's better to sort it out elective measure. When you have an emergency surgery, if the intestine is gangrenous or something, then we cannot place a mesh and repair the hernia. So that time we have to just do a simple repair, and again after a couple of months you may require a mesh placement. So to avoid these complications, get an opinion, be mentally prepared, and then you can plan for the surgery accordingly. Thank you.